How's the diagnosis of spring allergies made?
Well, the diagnosis starts with a simple history and physical exam in the office, and that can often lead to skin testing, which should be done by a board-certified allergist.
And the skin testing, what goes on with skin testing? Is that behind the doors?
So skin testing actually is really simple. You're going to disrobe from the waist up. You're going to have some plastic devices used to just barely scratch the surface of your skin.
And when you scratch, what are you looking for when you scratch? Do you have to put a drop of something on it or what?
Yes, that's right. We put a drop of antigen on the tip of the device, scratch that through the skin, and then look for your body's response to that.
And the body's response, if you're allergic and you scratch the skin, and we were doing oak tree because they were having problems in March, April,
Yes.
What would it look like?
Just a small swelling surrounded by what's called a flare, which is some redness that we can actually measure in the office.
So it looks like a mosquito bite?
That's right.
Does it itch?
It certainly itches if you're allergic.
And how long does the itching last?
You know, itching lasts usually just minutes to an hour maybe.
So it's not really anything that's going to last for a long period of
Oh,
time.
no.
Now, do you do several trees, or are you just looking for 1 or 2 trees in this
Oh,
area?
we do nearly 20 trees on adults.
Because there's a lot of trees that
That's
cause
right.
problems.
There's a lot of pollen trees out there.
So are people allergic, if they're allergic to trees, do they show up to all 20, or they may show up to 5, or everybody's different?
That's right. Everybody's different.
And when you show to tree pollen, that tells the doctor which tree is causing the problem. Then you go to grasses also?
That's right. We have grasses and ragweed as well, as far as the seasonal allergens.
And what time of the year is ragweed usually?
Ragweed starts in very late summer, but really picks up in the fall.
Okay, so we've got spring allergies, we've got trees and grasses. We put on the little prick test to that. They show up to a little redness and a little itching place, and then we know that they're allergic to those things.